start off by asking you, through your lens, what do you think the biggest challenge or the biggest issue for Hispanics to achieve health and well-being is at the moment? Marissa.
I think right now for Hispanics, there's a lot of distrust. I mean, during COVID, we back up and say, I lead a nonprofit in Southeast Dallas, so I see day in, day out what's happening with the underserved. The community that I serve is 80% Latino, and I started in the middle of COVID. There was a lot of hesitancy around the vaccine, a lot of misinformation, because systemically and over the course of time, Latinos, Black and brown people, have really been disenfranchised. And so a lot of the work the biggest challenge that I see is really, it's a trust issue, and then it's also a systemic issue. It's having health care in underserved neighborhoods for people to access. Stop there.
Veronica?
I think that COVID was, for me, a spiritual awakening for us all, right? We started to look inside to see our health. Like, how strong are we? How resilient are we? We're not stronger than we thought we would, right? Especially those who've been affected by COVID directly. And also part of what I do is I work for ISP Creative and Impact, a division that's starting to work on well-being for corporate America too. Like, how do those conversations happen? And in talking to them, I realized that people now have a desire to want to do better as an individual, right? We started to realize that no one's gonna take care of us but ourselves, right? So it's a different lens, I think, and I've seen more and more of that. And honestly, I can't keep up because more women, especially Latinas, know that we hold a lot of power in our house. We're the examples. We're the women leading our communities. So we know if we're not taking care of ourselves, none of that is gonna have a foundation to build upon.
Samantha.
Is this on? Oh.
Yes.
There it goes. I would say a lot of the fundamentals that I've seen are those basic fundamentals. Claudia mentioned quite a few up front, that we want to improve our jobs, our health, our location, our education, gender equity. That's all that matters. And working in the physician world, the number one and number two biggest issues we've seen with patients accessing care are transportation and our finances. So number one and number two. 90% of physicians say these are the issues why patients aren't receiving proper care, and those are the people that are in poverty. Those are our Latino or colored communities. So I think just to focus on those fundamentals can vastly improve where we are today.
Amanda?
Obviously, it's not just one issue, and they've mentioned some of them, but I think accessibility is a huge issue, and it became very, very noticeable during COVID, especially when the vaccine came out. I'm also in a heavily Hispanic community or part of Dallas, and that's also heavily low socioeconomic status. And when at the beginning, when you have to stand in a line for 3 hours to get the vaccine, you can't just miss work. You can't get work, take a day off of work to stand in line and get the vaccine. So you're already putting your health second, because it's necessary, because you also need money. So it wasn't until further down the line that some programs were put in place, and the vaccine was becoming prioritized to specific zip codes. Doesn't mean that some people were trying to get into those zip codes, but it took a minute. And so that highlighted one very specific issue, and that's accessibility. And that doesn't happen just for the vaccine. It happens for regular doctor's appointment. It's a lot easier when you're on higher socioeconomic status, when you're in a more position of power, to say like, oh, you know what, I'm not gonna be here from 10 to 11 to have a doctor's appointment. Not everybody has that privilege. Not everybody has a car. Some people depend on public transportation and have to take several buses to get to the doctor. So accessibility, I think it's a big issue, and it definitely became highlighted during COVID.
So we didn't have the best accessibility to begin with, but Amanda, I'll start with you. How much did COVID set us back?
How much does COVID set us back? I think there were some positives. Like I said, it highlighted some issues, and it has led to a lot of programs to be put in place. I can think of one example. that's not specific to the Hispanic community, but that lowers those accessibility issues. Baylor Scott and White has started a program of health and wellness centers. I've been to one. I've had the pleasure of meeting the president and got a tour of the Baylor Scott and White Health and Wellness Center at the Juanita Craft Recreation Center, which is in South Dallas, a primarily Black, poor community. And it's the same premise. It's putting the center where the people live, so a person doesn't have to take 3 buses to get to the doctor. Is making the center multidisciplinary. So there's different specialties of healthcare in the center, so the patient doesn't have to take 3 days off every 6 months to visit the nephrologist and the primary care physician and the cardiologist. They still have to take the 1 day off. They come to the center, they see all their doctors, they see a nutritionist, they get a fitness program, they get a cooking class where they're taught how to cook the Southern food that they enjoy, but in a healthy way. They bring a farmer's market every week where they get to buy fresh produce for super, super cheap, because it's a lot cheaper to buy canned food. It's a lot harder to get to the fresh produce. This is bringing it to them, and it lowers that. It lowers both the economic accessibility, but the physical accessibility by putting it in the community.
Well, if I could
See you
just
nodding. I see you nodding. Jump in.
I'm like, yes, girl. I'm right there with you. But just piggybacking on that, I know in Southeast Dallas, for every 100,000 residents, there are 54 physicians. The national average is 225 physicians for 100,000 people. So that's just one data point. The other that was stark to me is if you live, this is where zip code can determine your outcome. If you live in Southeast Dallas, you will most likely live 22 years less than someone living 2 miles north of I-30. That is a systemic issue. That's a policy issue. And those are the kinds of things that we were seeing out of COVID. And it was healthcare, but it was also housing. It was also the fact that we don't have a grocery store and access to fresh foods. And so, the good news is I feel like Dallas has really rallied together. That spotlight was really bright in South Dallas. There's a lot of things happening. We're just about to finish a health clinic that will be a medical home for all of Southeast Dallas that is in partnership with Parkland, that will have an integrated care model. So not only will we have general practice for the community where people will have their primary doctor, not where they'll have to wait hours and hours to get a slot, but I know that I'm gonna go see Mr. Cardenas or Dr. Cardenas, and that's my doctor. But they'll also have access to a dental clinic, and then Jubilee will provide preventative and health and wellness programs upstairs. And so what that does is really hit the preventative and the behavioral aspect, the wellness piece, so that we're looking at why is it that residents in South Dallas are twice as likely to have diabetes, 3 times as likely to have heart disease. Again, that's not because people are saying, I want to be unhealthy. That's a systemic issue that we're trying to address.
Samantha, yesterday you, as we were prepping, you said something that really caught my attention. You said sometimes it's not your genetic code that determines your health, it's your zip code.
Yeah, so like I've said before, everyone's been communicating, the wealth of a community is directly correlated to the health of the community, period. So the more prominent communities, you notice they're healthier people, healthier all around. This is a systemic issue, an access issue. Like I said earlier, top 2, transportation, finances. Those are the biggest issues we see in these zip codes. Even doctors, number 1 and number 2, I believe 90% said they see this in all of their patients. So again, it was just, like I said, zip code is correlated.
Veronica, how do we start turning things around? I know that you are a big believer in corporate responsibility programs. What is the solution? I know that there is not one solution. It's a very complex topic, but where do we start?
Absolutely. This makes me so excited. I have to sit up, right? Because I think that in my own self-discovery, I've really uncovered an untalked about characteristic as Latinos that we discover. It's our trauma, right? Where are we learning these habits? Where are we finding out that we don't want to go to the doctor? I can't tell you how many times I've had medical insurance and I had my PCP and I would wait 3 years to go get my well-woman's. I mean, there's a lot of us like that, like professional people in careers that have a lot of people depending on us. And our mindset is not that. It's because it's our holistic viewing of who we are as a person. And I think that's where the opportunity lies. Like, we can't rely on systems. We can't just continue. We know all this stuff is against us. But for me, in my experience, that's why I opened my own yoga studio. You know, when I was 30 years old, I had a stroke because I was traveling and working so hard. I worked for Visit Dallas at the time I was traveling, and I didn't take care of myself. I wasn't taught that early on, and I started doing yoga, which no one looked like me, and I wanted to open it because I wanted to invite people that looked like me. It takes just those little seeds of saying, you know what, my health is my wealth. It's the way that I look and the way that I feel and the way, again, the legacy that we're leaving behind. And that transcends into what I do today. And with ISP, we design those programs for corporations to say, hey, wellness, well-being right now, Mental Health Month, celebrating this month, is a problem. If you're not looking at that, even if you have 2 employees or you have 40,000 employees, if you're not looking at the holistic health of your employees, of yourself, we're just missing the mark. We're going to always be behind. You know, I know my friend Nina Vaca, who's a triathlon, right? Like, at that level of discipline and experience is the example. And to do
with so
that,
much responsibility.
Absolutely.
She's
also
very busy.
Oh my God, absolutely. But look at it from a business owner's perspective. Your insurance is down. We all know this. Like, we know that the value comes in money as well. So we start teaching that. We start implementing that in our culture and the companies, but culture at home. So my kids work out with me. They're 5 and 7. So again, I think that we need to kind of take our own responsibility, go back and figure out why we're not doing it, implement it in our workplace, our community, and in our families.
Amanda, and I know you have thoughts on that, personal responsibility, but first I'd like to ask the audience, raise your hand if you are very, very sure that you put your health and your well-being at the top of your list. Who would say that, honestly? Not very many. Why do you think that is, Amanda?
I don't know, but you gotta change your priorities, guys. No, we get caught up on, life is busy, life is hectic. We go on autopilot, and things like COVID need to happen to switch your priorities. It happened for me, not necessarily on the health front. I've always been very, health has always been a priority for me, but in other fronts, you know, COVID for me made me realize I missed my community so much. I'm a busy person. I like thrive in stress, and then all of a sudden I'm home, and it's not that home was busy because it was also busy. I think I have kids that feel like too many most of the time, but I missed the people. I missed my community, and that's one thing that changed for me after COVID, is I decided to prioritize my community and get more involved. And not that I wasn't trying to do it before, but it definitely moved up at the top of the list. And I wanted to hit on something that Veronica mentioned. She started doing yoga, and nobody looks like her. That's another aspect of healthcare that is very important, that needs to change from within. And it's, even though the Hispanic population in the U.S. makes up more than 17% of the overall employment, we only make up 8% of jobs in STEM. And that includes medicine. And so you go to the doctor, and the chances that the doctor is going to look like you are smaller. And not only that, research from medical centers suggests that having a more diverse program in the hospital, in the educational system, in residency programs and internship programs is important, because if you're Hispanic, you're more likely to want to work with the Hispanic community. If you're Black, you're more likely to want to work for the Black community. So overall, it translates into better healthcare for the patient to have a more diverse program. Now, there's a lot of barriers before that for that representation to get there, and that needs to change at the medical education level. Those barriers also need to come down, and those programs are only now being put in place, but hopefully the change will be there one day.
Marissa, so what programs do we need to foster? How do we educate families? How do we educate individuals and ultimately the community?
So I think a lot of it is just, it's building trust with our communities, building relationships. Something that, Amanda, that you just said made me think about the cultural competency piece. And we've been running over the last 6 months focus groups with our community to really understand what do they experience when they go to their community clinic? Why do they wait so long to go to the doctor? And then what kinds of things do they want and do they need? And what keeps coming up over and over again is language barrier that for their doctor and their healthcare team, nurses, but also understanding the cultural piece, how they eat, their family dynamics. They might have multi-generations in their households. They might have a tía and a tío or an abuela, abuelo, it's that happens a lot. And how does that impact food choices and exercise, and also prioritizing their own health? And I think just kind of what one of you, or Veronica, I think you were saying, women, we're caregivers, Latina women, we take care of everybody. We're the last ones to think, and I'm guilty of it too. I grew up in a house like that. We took care of everybody else. So your question was really more about like the educational piece, but I think it's really about getting into the community, building those relationships, also making sure they have access to culturally competent information and people that can help them in their journey for health and wellness.
No, but you talk about one very important point. If mama is not okay, nobody's okay. Si la mamá no está bien, nadie está bien en la casa.
That's right.
How big is the issue of mental health, especially for women?
I'll take that.
Yeah.
Go for it. I'll take that. I think, we have to acknowledge that we all have some sort of, again, issue with who we are at some point. I think for me, I look at our rites of passage, right? Like when we're young, we realize when we're alone, we find what that looks like. For me, I was a teen mom. I lost a part of myself then. We look at these things that happen to us in our life that are drastic, and sometimes it's a death or a grieving that actually begins to cultivate this yearning for finding out who we really are. And that's what I teach even my young girls, is like, we know who we really are, right? And when you find those moments of who you are, then you understand the importance of really showing up for who you are, right? And mental health is that issue. Again, I spoke on trauma because that's kind of my own self-discovery right now, is dealing with my trauma, because then I realize how it shows up in my money, in my marriage, in my friendships, and in my business. And I think we all kind of have to have a mental check-in with ourselves every day. On the news, we think mental health is bipolarism, committing suicide, and all these things. It's all of that thing, right? But I think on a spectrum of it all, there's a lot of things that we're not dealing with that we suppress that show up, right?
And there's also the cultural component again,
Absolutely.
right, Marissa?
Absolutely.
Yep. Absolutely. I mean, I would also say, and I can just speak from my own experience, growing up, seeing a therapist or a counselor was like, I'm not loquita. I'm not loca.
No estoy loca.
Like, what are you talking
Yo
about?
estoy bien, a mí no me pasa nada.
That's right. And, what I have had to learn and kind of challenge my own bias is that that's just healthy. That should just be part of, just like I go exercise or I need to look at my macros and pay attention to what I'm eating. Mental health is a part of that. And so I think that is something that we saw when COVID hit. Oh my gosh, we saw our kids, our elementary kids who were depressed, our middle school kids, our seniors who were living alone. They couldn't go out. And it's just something that, again, I talked about the spotlight. That was another big piece of it, is mental health is just something for all of us to pay attention to and to be aware of. And it should be accessible to everybody.
Yeah, it's another silver lining, maybe, right? Is COVID definitely exacerbated mental health in the world. But silver lining, maybe, it made it is that much more open now. People talk about mental health in a much more open way. Unfortunately, is probably because now you're more likely to have experienced a mental health issue, or to have had somebody in your family experience a mental health issue. But it's so great to know it's mental health is for everyone. Yeah. You know, it's not for the sick. It's not for the crazy. It's just part of your workout. It's part of your workout routine. It's
and disassociating it from shame.
Samantha, you want to chime in?
I just say we need to stop as a culture, as a group, justifying these bad habits. We need to, educate grandma. Tortillas with frijoles y arroz is not a meal. Like, we need I think it's just a huge lack in overall education in what health and wellness is. I mean, to me, health is a triad. It's your mental, it's your physical, and your emotional state of well-being. We need to make sure that we can hone in and focus on all of those. Just like they said, it's not just nutrition. You need to focus on your mental health as well, but also the education that is behind it.
To what extent is exercise a part of it? I know that you started yoga classes. Amanda, did I hear you say you started Zumba classes, teaching Zumba classes?
Yeah, salsa classes, salsa and bachata classes, guys. Tuesdays at 7 p.m. in downtown Dallas. But yes, that came out of COVID for me. I kind of hinted at that when I started talking about the community. But I found myself, if I'm being completely honest, I started these salsa programs with downtown Dallas kind of selfishly. I missed the community. I missed salsa. I missed dancing. I've danced my whole life. I've trained in dancing since I was 5 years old, and all of a sudden I'm locked at home. My workouts are very lonely, right? I'm not doing group fitness. I'm running around the neighborhood. I missed it, and I was looking for a way to bring it back to my life, to bring the community back to me, and to make it COVID friendly. And I started this program where I teach free salsa and bachata lessons in different parts of downtown Dallas. And it started from that, but it became so much more. It became more successful than I ever thought it would. Hundreds of people have joined my salsa classes, and two things were immediately highlighted. I had families coming with their kids. I had couples coming. I had single people coming, but they would come to me at the end of the class and thank me for making salsa accessible, for bringing it to downtown Dallas, for making it free. So accessibility comes back, but then I had people of all backgrounds, races, and ethnicities coming to these classes. And more than a few people would come and thank me for sharing culture and for celebrating culture in downtown Dallas. It was like, you're making downtown Dallas feel like a city because you're celebrating other cultures. And so it became much more than just me wanting to salsa dance for an hour. And it's continued. It starts again tonight. So I won't be at the partying with you guys later, but I'll be salsa dancing in downtown Dallas.
There's a party? Wait, there's a party?
No, I don't know. Yes.
So we
yes.
hear.
Go ahead,
Veronica,
add
go ahead.
to that, during COVID, I don't teach yoga as much as I'd like to. I teach meditation and mindfulness. And during COVID, we would do live sessions for free. And I think that's where I began connecting with all of my friends on Facebook and Instagram. And everyone were like texting me like, hey, are you going to do the meditation tonight? I'm like, I need a day off. So they were, it becomes a lot of pressure, right? Like the responsibility once you take on, I think that I just wanted to note that we get so energized and excited about our health and bringing our friends to go work out. And then the pressure comes where we have to manage that and maintain that. as well. And I just want to take away that stigma.
How do
or
we
reclaim
do that? How do we
right?
change the priorities? Where do we start? What's the first step?
Well, what I'm learning is don't let people tell you what you should be doing and when. You know, at the same time, I'm like, I'm going to cultivate this, and it's going to happen on my time and when I'm ready, because I want to be fully present, right? And I think that we need to adjust ourselves a little bit. And I know the pressure's on because of digital, and everyone's moving fast, and we're all coming to work, and we're busy. But I find that there's protecting your peace, right? Like at the middle, if I don't teach yoga anymore because it's becoming work, then that means I need to kind of scale back. Like I've been working out every day, like when do I scale back? And it's just knowing who you are and learning that and finding that nice balance of peace. And you tell you what to do. Don't let anyone else tell
Samantha, what do you think?
Just to, I guess, piggyback on everything that everyone's saying, I just think when things are at their best, you are at your best. We just need to hold each other to excellent standards across the board. Don't hold yourself to them, hold you, hold everyone else to it. As Marty said, don't just sip on the Kool-Aid, chug the Kool-Aid, and let's chug it together all in the right direction, leading to this same mission-driven, I guess, group that we want to all be part of.
Marissa?
A lot of thoughts thinking about this. I think the three of you have inspired me to maybe start exercising some more. But I think, I go back to, I guess this is just the world that I'm in. It's, it's in everyone's best interest that this entire city is healthy. And it's not just about like, oh, pobrecitos in South Dallas. This is not about charity. This is about equity. This is about doing what's right. And if you don't look at it from it's just the right thing to do, you should look at it from, we are only as strong as a city as our most vulnerable. And right now, South Dallas is really lacking in resources across the board. And you look at housing and healthcare and education and workforce, across the board. So I think, I keep going back to that, but I really think it's an economic development proposition for the city, for all of us to be healthy and well.
Amanda, what do you think? What are the steps to make health and well-being our priority?
I completely agree with what Marissa just said. We want to invest on our city. You want to invest in your community. When you get to that position of power and you're ready to give back, or that position of privilege, or whatever you want to call it, and you're ready to give back, you definitely should. And I think one thing that I keep in mind as I think about my personal projects that I want to start with the community, I think of two things, and I've already talked about accessibility and length, but the other one is passion. When you get to that position where you're privileged enough to give back to the community, I think you want to pick something that you're passionate about, because you're going to be that much more invested in it, and it comes through. And Veronica hit on something that's really important too, and that is balance. When you're not showing up at your best, then you have to pull back a little bit, and I completely agree. I absolutely love my salsa programs, for example, but I set a time that I think is appropriate for me. I usually start the programs, I make them 4 weeks, or I make it eight weeks, but I make sure they have an end date so that I know that there's going to come a time where I don't have to plan a class every week on top of everything else, and that I'm not going to be burnt out, and that when those classes happen, they're joyful, we're celebrating, we're having a blast, we're moving, and they're right. So I think, to me, it's two key things, is thinking about accessibility and those barriers that you want to lower for the community, and then picking your passion. If that is, for me, passion is fitness and science, and that those are always the routes I'm going to take. But maybe for you it's law, art, hairstyles, whatever it is, that's the route you should take.
Veronica, circling back to the role of corporate America in the health and well-being, especially of the Hispanic community, who are the stakeholders? How do we hold them accountable?
Well, I think that all of us need to check our intentions, right? So any time you go into a conversation where holding people accountable, I always kind of do an intention and a check for myself. And I think that right now is the time for us to go and have these conversations about our health, right? We're like, someone just threw us a great opportunity, right? And I think that if we lead with that, because the value is really that. You can't do anything without your health, right? So if you're
Sin
bold
salud no hay
enough,
nada.
absolutely. If you're bold enough right now and you have the desire and your intentions in the right place, then the universe meets you where you're at. Then the people are going to come into your way. Then that conversation's going to be easier at the break room. But it's the inspiration in which you carry that, right? Like me, if I talk about health and wellness, I don't have to talk about it. I can walk into a room and it's felt, right? It's that whole energetic whole being of yourself and your intentions right. I think that we're primed. COVID has allowed us an opportunity to go have a courageous conversation about the people equity that is being invested into in the organizations that we work for. And I say that in small organizations of employees of 4 or whatever, like now is the time to have the conversation. And that's why, we are human. All this is appropriate. Now is our time. And then we're the fastest growing, and our population in Dallas alone, that gives us the equity to go in and have a conversation because we represent a large consumer base and we know our stuff, and we know that that's the right thing to do, is making sure that everyone is healthy, their mind, body, and spirit, at work, at home, and in their relationships and friendships. I think that we need to have the courage to say that and stand for it.
Did you want to add something, Marissa?
Amen to that, sister. That's what
I think we're almost out of time, but I want to ask you, these past 2 years have been very hard on all of us. Personally, what were your biggest challenges, and what did you do? How did you deal with them? Amanda.
I think I already spoke to mine, and my biggest challenge was kind of that isolation, even though I was really in a house with 3 kids and my husband, and a brand new baby at that, but there's a difference between being a parent and then the rest of your person, the rest of the woman that I am outside of being a mom. And that part was missing when I was having to be home all the time. I miss the community. I think pre-COVID, I would have probably considered myself pretty antisocial, but I guess it turns out I'm not. I did not do that well in an antisocial environment. So that was a challenge for me. And, like I said earlier, it led to me rearranging my priorities a little bit once I had the chance to come out.
Samantha.
Being a creature of habit, COVID really threw off my everyday habits. I live a very structured lifestyle, so just reordering my entire life, I realized, I guess I was a lot more social than I realized as well. I thought I was pretty quiet, stuck to myself, and then I realized how much I missed going out to eat, how much I missed going to the gym. That's probably one of my main ones. I like waking up, going to the gym, so just reorganizing my everyday habits in life and forming new ones that still kept in mind, again, that triad of health, and keeping in mind my health, my wellness, my spirit, all of it. That was just, it took a while to reorganize that in a way that worked with the COVID world.
Veronica.
I think for me it's death and loss, right? That is the most challenging thing that we experience as human beings. And to see that, I've been fortunate that no one in my immediate family experienced, but close friends, colleagues, people on Facebook, you saw it every day. And even if one person didn't affect you, something along the way did, right? And I think that for me was seeing a lot of my friends and my community experience that at a level that's just, it's crazy to me. And I understand that it was kind of, shocking to us all. But for me, I look at it and I take complete appreciation for life from that. And it's part of, life, right? Death is going to happen to us all at some point. But I think that was my biggest challenge, is to witness a lot of my friends lose a lot of people and lose themselves as well. So,
Marissa.
I think a lot of what you all said, but I think the biggest thing that if I reflect back is I felt really guilty. And I was going through my own challenges. I had 2 kids at home that were homeschooling. My husband was home. I experienced loss in my extended family because of COVID. I'd started this new job, and I was trying to take care of everyone, but seeing how the community, what I wasn't experiencing, I had access to health care. I had access to COVID tests. but the community that I served didn't. So constantly just feeling like I wasn't doing enough until I just burned. And then realized, okay, I've got to take care of myself. So all of the above.
For me, it was working from home. Turns out I miss my colleagues more than I ever thought. Even the annoying ones, I missed them. So we're out of time. Very quickly, 2 minutes. If you had a magic wand, what would you change so that our community is healthier overall?
I think
Yes.
that I would change that everyone has a relationship with themselves first, because you can't take care of anyone if you don't take care of yourself. So I think if everyone can take that on, we would all be good.
Marissa?
I mean, I said this a lot. I think it's the equity. If I had a magic wand, I would make sure that our neighborhoods had access to fresh food and produce and a medical home and quality health care. So I think it's really about equity and access.
Samantha?
I couldn't agree more. She stole mine. But just nutrition. I think education on nutrition is so big. Everything about what we put in our body exudes what comes out of us. So that'd be my big one.
Can this magic wand do like a bunch of things, not just one?
You can do whatever you want it to do.
No, I think they already hit on a few of the important things, but just bringing it back to that common topic that we heard a lot during this conversation, that zip code topic. Maybe I would go like this and like remix the zip codes a little bit. So some of those families in the low socioeconomic status with young children can have the chance to grow up in some of the other neighborhoods and just mix it up a little bit more. I think it's no secret, I don't think, that one of Dallas' biggest issues is segregation and the segregation of the communities. And so I think if I had a magic wand, I would mix it up a bit.
And at the end of the day, we are all our own best advocates. So let's focus on our health and our well-being. Let's put that first. Thank you so much. I've enjoyed meeting you so much. Thank you for allowing me to moderate this panel. It's been a pleasure.